Hello, this is Dr. Lewerenz, the Longevity Health Institute. I hope this finds you well, but let me tell you about prevention for the coming flu season, and actually the present flu season. Actually, we're here in early December, and the CDC has come out with data that shows that we're already in a very early stage of the flu. And these strains that are there, which looks like the vaccine, if you've had the vaccine, look so far like they're successful in the strain that is covered. So that's a bonus, but things can change, and we don't really know 100% for the next couple months. So when you talk about is it the appropriate vaccine that's that efficacious, you probably aren't going to know till February. But here in early December, we're seeing a rise in the country, not yet in Michigan, but it's probably coming this way. And you have to think of this, all the travel and holidays and virulence that's passed in airplanes and buses and traveling. That's what brings it around the country. Okay, so how can you prevent and protect yourself? Well, first of all, you have to always think about how we think about health in foundational systems. You got to have a good foundation to be well, correct? So your diet has to be good, sleep is important, de-stressing, okay, and essentially living in balance. Now, that's not going to happen during the holiday season, correct? I'm sure. But at least be mindful of these things. Try to get some decent sleep, 7-8 hours. Try to get some recovery after parties and events and get-togethers and socializing. After drinking, maybe have a day or two of detoxifying, drinking a lot of water, take some extra milk thistle. But a few foundational things that are very, very important to actually prevent the flu and to prevent, the season that's upon us, December through, March, April, all these viruses and bugs and influenza around, is optimizing vitamin D. Super key. You don't want a vitamin D in the 30s or 40s, which is adequate for bone health. You want it 60 and above. I shoot for around 80 because studies show actually a much higher immunity, a higher CD4 count, your helper cells in your body, your immunity is much higher and much more robust to fight infections, not just the flu. So what does that mean? Well, first you got to get your vitamin D tested. So your primary care internist, us, etc., quality doctor that's looking at details needs to get your vitamin D up near 80, 60 to 80, okay, is optimal, okay? Now, details of this, obviously you need a little bit of vitamin K in balance with magnesium. Don't excessively consume calcium, but the idea here is to have, in the winter months, a much higher vitamin D. Now, vitamin D is a fat-soluble vitamin. It's harder to absorb. You might need to take, and this isn't directing everybody to do this, but in a personalized way under medical supervision and lab testing, sometimes I have patients that need to take 20, 30, 40, 50, even 1,000 IUs for a few days to load them to get their vitamin D up to a higher range. Now, if you're not taking vitamin D, and if you're not routinely regular in the sun, or if you've had a lab test that shows a vitamin D in the lower quartile or definitely under 30, get some vitamin D3, okay, with a meal that has fat in it, okay. Take for 3 days 25,000 IUs, and especially if you're sick, especially if you have a virus that's giving you aches and pains and chills and sinus congestion and you can feel this thing coming on, hit it head first with vitamin D and then get your vitamin D tested. You don't want too high of vitamin D, but you want an optimal vitamin D up near 80. 60, 80 is more ideal, okay? Bone health starts at 30, but high quality optimization of your immunity starts at 60 and 80, in that range, okay? Now, most of the time you have to dial down your vitamin D after it's a fat soluble, so it stores in your body, so you don't have to take high doses long term. Most doses I keep people typically on are about 5 to 10,000 IUs. But again, foundationally, good diet, good sleep, de-stressing, a lot of fluids, don't drink and party too much. Vitamin D, optimal. The other thing is this, here at Longevity Health Institute and our practitioners, we're always using a water-soluble, hydrolyzed, vitamin, silver, hydrosol silver, Now, what is that? That is not colloidal silver. It's water-soluble silver. It's 23 parts per million. Argentine 23 is a company that we use. Sovereign Silver is also another company. But these are small parts per million, which mean they travel through your body. They're antiviral, immune boosting, very, very safe. They don't trap in your body like colloidal. I'm not a fan of colloidal silver, 10 parts per million. You want water-soluble silver at 23 parts per million. Now you can get this on our supplement shop at our website, but a misting spray of it in your nose liberally 3-4 times a day when you're fighting a cold or a cough. I also love it preventatively flying on planes. So everyone that's going to see loved ones and get on these bug air buses, they get pressurized, and then you get this infection in the sinuses that goes to the ears and then eventually to your respiratory system, okay, because everyone next to you is either blowing their nose, picking their nose, or coughing on you. And yes, we've all been there. Use silver on the way to the airport, at the airport, liberally, in the plane, misting silver nasal spray. Again, I'll tell you at the end of this video how you can get it on our supplement shop and our website, but make sure if you get it anywhere else that you're getting actually a high medical grade silver, okay, because it's antiviral, antimicrobial, it's an immune boosting, but you want it at 23 parts per million. Okay, the bigger the parts per million, the better it absorbs, the more efficacious, effective it is, okay, against these viruses, but also it does its job and then it goes out of your body. You excrete it out of your body. You don't want colloidal at a smaller parts per million because that can trap in your body. So again, high optimal vitamin D, de-stressing, good sleep, okay, good diet, good nutrition, foundational systems, right? The other thing is the silver. Okay, silver is very antiviral, and again, this type of season, whether my patients are out of state, traveling a lot, businessmen, CEOs, etc., athletes, you name it, I use this liberally, and everybody, I personally use it every time I travel. But if you get a little sniffle, get a little cold, first thing you can do, you can even spray some of this sublingually so it gets to your system, okay? Other key thing is this. Long term, yes, you hear me preach here about being gluten-free and dairy-free and low sugar, okay, and more plant-based, if you will, a bit paleo, but vegan, paleo, plant-based, and that's a whole different discussion. But when you have a virus or you're sick, okay, you don't want to cause any other workload on your immunity gut system. So yeah, you can take probiotics, you can up your vitamin C, which is super, super key. Antiviral, I'm very big fan of zinc, high dose vitamin C, even garlic supplements or eating garlic, they're all very antiviral, okay? But do your gut and your immunity some good when you're sick, and that's hydrate, 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 okay? But also no dairy and no gluten, because even in that moment, you're putting extra burden on your body from an immune standpoint, creating inflammation that your body has to work against, and then you have that negative effect while you're trying to create all your energy systems to build your immune system to fight this virus, okay, and get you feeling better quicker, okay? This is typically very important too, especially on the dairy and gluten end, if you have anything sinus or respiratory that you're producing a lot of mucus and phlegm, okay? Dairy creates more phlegm and more mucus, so absolutely get off that, okay, and avoid that, okay, if you aren't already. The other thing is, studies show this, and this is excellent for a virus and for the flu, okay, but chicken noodle soup. Yes, of course, I would preach and say, use organic, use your mother's made, home recipe, or get some, whole food, Plum Market, Better Health, organic, well-stocked chicken broth, but chicken noodle soup. But there are studies on this that can actually shorten a viral course by 20%. Now, doesn't sound that impressive, but when you think of days, that can save you a day or two in your viral, prodrome and syndrome that you're going through. And I think that can be very, very efficient and very, very helpful when you're miserable, right? So remember these simple steps: silver, vitamin D, chicken noodle soup, good sleep, okay? Less inflammation in your diet, treat your body well, hydrate, okay? The worst thing you can do is when you have a virus, okay, and I'm even suspect and even, to this, and that is, we want to go about our day and push ourselves and work out and go to work and, hey, I'll just fight through it. Well, you're stressing your immune system. Probably the worst thing, and I've done this myself, don't exercise or overly exercise when you're trying to fight and mitigate, get rid of a virus, okay? Give yourself rest, hydrate, treat yourself well, you'll get better quicker, okay? Because your body needs that healing ability, all right? So how do you get our supplements? How do you get our Argentine 23, our silver? How do you get vitamin D3? How do you get all our vitamin C products and probiotics and all this? Go to our website, Longevity Health Institute, Inc., okay? On the page, scroll down to the supplement shop. When you click on there, our fulfillment company, our warehouse, all high-grade, GMP tested, third-party medical grade tested supplements are on that site. The password or passcode to enter the site is health, okay, small HEALTH, okay, and you can create an account. It's delivered to you at a discount rate, and shipping is free over $100, and you'll usually get it within 2 to 3 days, okay? And you're getting high quality medical directed products, and I think that's super, super key. Always look for the GMP third-party tested stamp on all your supplements, okay? So hopefully this helps you. Yes, the flu is going to come and probably hit us more January and February and March, okay? Remember these things now. It's actually in the country on a early rise. This was just published by the CDC, okay, and put out there. We won't really know what the season's going to be like till January, February, but you can still use these things preventatively and keep these things in mind, okay? Hopefully this educates you on the flu season and about the viruses to prevent. We also, as you know, always offer IV therapies that are really good to when you get the virus, if you can nip it in the bud right away, high dose vitamin C, and actually silver drips that we do intravenously. Very good immune boosters. You can take us up on that. Go to our website, follow us on Facebook and YouTube here. You'll see a lot about our IV drips, okay? Longevity Health Institute, 2 locations, 3 soon. All our practitioners, highly qualified and certified, bringing you the best in functional personalized medicine. Be well. This is Dr. Lewerenz. Have a great holiday.